doctors. Today we'll discuss about another question from the embryology. A 5-year-old girl is brought to her pediatrician because her mother says she is frequently bumping into stationary objects while playing. Visual field examination shows bilateral peripheral visual defects. CT scan of the head reveals calcification in the pituitary fossa. Which of the following is the most likely origin of this child brain tumor? Number first, that the tumor is present in the pituitary gland. Number second point here, that is the patient suffering from bilateral temporal visual defect. And number third thing that we have to take into considerations, that is the age of the patient, that this is a girl of 5-year-old. So before going through the answers, I would like to demonstrate some relationship between the pituitary gland with that of the trach of the optic fibers or the visual trach. So for that purpose, I have a presentation here that in case of any tumor of the pituitary, there may be some effect on that of the visual pathway. So for example, I make here a sella torsica, the pituitary fossa, in which present the anterior lobe and posterior lobe of the pituitary gland. This is the pituitary stalk. So during the embryological development, what happened, the anterior loop of the pituitary gland is formed into the upper surface or the roof of the oral cavity. Here the formation of the pouch, and then this pouch migrate and form the anterior loop of the pituitary gland. So that is called as the Rathke's pouch. So in some conditions, then there is a formation of the tumor into the Rathke's pouch, which leads to the tumor of the anterior loop, and it causes the suppression of nearby structures. So what are the structures which is present in front or near to the pituitary loop? That is here the optic chiasma, or the crossing of the fibers of the optic trach. They cross and go to contralateral eyes. Okay, so this is what a point of the optic chiasma, which is commonly suppressed by the pituitary tumor, mostly the tumor of the anterior loop. It causes suppression and it causes the visual defects. So here we can see the tumor is formed just above that of the optic chiasma, and it causes the suppression of the optic chiasma. So definitely it causes a visual disturbance. But which type of visual disturbance we can see in this complication? For example, here we can see the pathway of the optic trach. So for example, I am seeing the object here, okay, and this is the temporal part and this is the nasal part of the object. So the nasal part of the object, it form an image on the opposite plate of the retina on the opposite side, while the temporal part form on the nasal part of the retina. So after here also the same formation on the opposite side and on the opposite side. So when the information is copied by the cells of the retina, it conduct the message down and it cross at the point number 2, that is the optic chiasma. The same is here on this side. The message is carried and cross at the optic chiasma. But what about the temporal side? The temporal side is coming straight and without any crossing, it go to the same side of the cerebellum. So here again the same. But if the tumor causes suppression of this area, okay, so what happened? The trach, this one and this trach, they fails to conduct a message. So this area will not conduct, this area also cannot conduct the message to the cerebellum. So this portion cannot see and this portion cannot see. So we can say that the temporal part of the object is unable to form on the cerebellum. So that's why a patient cannot see the temporal part of the object, but the nasal part is still a patient can see. So it is the half of the object. Okay, so we can say this condition bitemporal hemianopia. So any tumor of the pituitary gland, most specifically the tumor of the anterior lobe, cause the suppression of the optic chiasma and causing the compression of the crossing of the neurons at the optic chiasma, which conduct the message from the temporal side of an object. So if the compression is occurred, so the temporal side of the object cannot seen by the image, and this condition is called as the bilateral peripheral loss of vision, or we can say bitemporal hemianopia. So in this condition, the first option is there is adenohypophyseal lectotroph. Yes, it is also a tumor of the anterior pituitary gland, but it is more common in older ages. It is not common in less age or early ages or the smaller younger ages. Okay, and it is also causes the increase in the level of the growth hormone, increase in the level of the ACTH and lectotroph hormones. Okay, so it is not our answer. What about the fourth ventricular neuroectoderm? If the fourth ventricular neuroectoderm is occur, then definitely it does not cause the visual disturbance. So Rathke's pouch, we can say that it is the answer, because it is the pouch which is formed during the embryological development into the upper roof of the oral cavity, and then it goes to the anterior pituitary loop, and the tumor of this embryological pouch, it leads to the compression of the optic chiasma. So what about the vascular endothelium? Vascular endothelium is more common into the cerebellum and the spinal cord, which causing the cerebellar activity defects, for example loss of balance and ataxia, cerebral ataxia. Okay, about the ventricular lining. Ventricular lining, most commonly if the tumor of the specialized ependymal cell, then definitely there is excessive production. If it is benign tumor, excessive production of the CSF leading to the hydrocephalus, or sometimes it causes the obstruction and leading to again leads to obstructive or non-communicating hydrocephalus. So best option is there of the Rathke's pouch.